This is Professor Emily Mercuri, and today we are covering Chapter 6, Safe Dosage Calculations in Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to 1. Review basic functions of a calculator, 2. Calculate arithmetic problems using fractions, decimals, percentages, ratios, and proportions, 3. Solve dosage problems using the basic calculation method. 4. Solve dosage problems using the ratio and proportion method. 5. List the cautions with the basic calculation method. 6. List the cautions with the ratio and proportion method. 7. Calculate safe dosages for infants and children. 8. List the variables when assessing geriatric patients for safe dosage. And 9. List 5 steps to reduce medication errors. I would also like to remind you at this time that I am by no means a math professor, so I will be going through this chapter from a perspective that you already have some base knowledge of math. If you find that math is something you really struggle with, there is math tutoring available here on campus, and I am happy to do office hours with you as well. Functions of a calculator. Healthcare professionals are dedicated to help, not harm others. This principle is imperative in dose calculation, preparation, and administration of medications. The smallest mistake can be detrimental. So it is your responsibility to ensure the dose administered was the exact dose prescribed by the physician, and it is also important to understand the difference between adult and children dosing. A working knowledge of basic math is required for accurate calculation, as I shared. So just reviewing a calculator, the basic function keys on a calculator include addition, which is a plus sign. It is 2 lines intersecting, one pointing horizontal, one pointing vertical. Subtraction, which is 1 short horizontal line. Multiplication is on the calculator, it's either a little asterisk symbol or an X. Division, which is a slash line, kind of like a diagonal line, and then total, which is the equal sign, which is 2 horizontal lines on top of each other. It is always critical to double check your calculations and ensure you get the same answer, especially if something feels wrong to you once it's complete. The concept of fractions is also something that you need to be familiar with. So I talked about this a bit in the lecture for Chapter 5, but the numerator is the top number of a fraction, and it stands for how many parts of the whole exist in the fraction. The denominator is the bottom number of the fraction, and it represents how many equal parts of the whole is going to be divided into. Key concepts to remember: when you are adding and subtracting fractions, the fraction must have the same denominator, so that bottom number must be the same. You will add or subtract the numerator and leave the denominator the same for your final answer. If you need to add or subtract fractions with a different denominator, you need to find what's called the common denominator. So let's say, for example, that you have 1/4 and you are trying to add it to 1/5. A common denominator that both 4 and 5 go into is 20. So you would say, I'm going to multiply the fraction to get a bottom number of 20. So 4 times 5 equals 20. So you would have 5/20. So 1/4 equals 5/20. And then you would have 4/20, which is 1/5. So then you could subtract or add those top numbers, leaving that denominator the same. Decimals are very similar to fractions. You can change decimals to fractions and fractions to decimals, and rounding decimals is important for administering the correct dose of medication. So many tablets are scored, which what that means is that on the actual pill itself, there is a little indentation, a little line, and you either can push both sides of the tablet to snap that in half, or you can use a pill cutter depending on if it's home use versus hospital, and that allows the tablet to be evenly divided into half. If a dosage calculation totaled 1.48 tablets, you would need to round up and administer 1.5 tablets. There's no way that you would be able to cut it with that tiny little decimal, so you have to round it to the nearest 0.5. Anytime you need to add, subtract, multiply, or divide decimals, it's imperative that you use a calculator to ensure the proper dose. Always double checking the math, even if it's pre-calculated in the EMAR, which again is the Electronic Medication Administration record. Percentage is a number over the denominator of 100. Referencing U.S. currency is helpful when calculating percentages. So a quarter is 25 cents. The decimal form of that is 0.25. Anytime you are using a decimal, you need to make sure you say 0 point. Never leave the 0 out because that helps to clarify the number. So 0.25 or 25 over 100. Okay, because a dollar is 100 cents, a quarter is 25 cents. So 25 over 100 equals 25%. A quarter is 25% of a dollar. There's a figure on this slide that shows the decimal place value chart, the whole part and the decimal part. So the whole part on the left, and then the decimal point, and then the decimal part on the right. So on the whole part, you have millions, hundred thousands, 10,000s, thousands, hundreds, tens, and ones. Decimal point, tenths, hundreds, thousands, 10,000s, 100,000s, millions. So just look at this table if you're confused about what I'm talking about. It's kind of a good visual representation of whole parts of a number versus decimal parts. Concepts of ratios and proportions. Ratios and proportions are used in healthcare and medicine as a way to compare measurements. They're used to solve various equations and foster comparison between two unlike items. What a ratio is a comparison of a number through division. An example would be an instructor has a student-to-teacher ratio of 15:1, which means that there are 15 students to one instructor. Ratios work similarly to fractions. A proportion, on the other hand, is an equation that states the two ratios are equal. If you're solving a proportion with an unknown variable, you need to cross-multiply. So the example given here is 4 over 2 equals n over 3. You're going to need to cross-multiply to find n. So cross-multiplying yields, you'll multiply the numerator of the first with the denominator of the second. So 4 times 3, so 12, equals 2n. And then you'll have to divide both sides by 2 to get the number for n. So dividing 12 by 2 gives you 6, n equals 6. Knowledge check. Which function represents multiplication on a calculator? This one is hard to do via audio lecture. Hopefully you can just pull up the slide. But A is a horizontal line crossed by a vertical line. B is a slash. C is an asterisk. And D is two horizontal lines stacked on top of each other. The answer is C, and it's the asterisk. Remember that that could also look like a letter X. Calculation guidelines. So calculations are essential in safe drug administration, and patients must understand the importance of taking their medicine according to physician order. Providing both verbal and written instructions along with demonstrating proper administration techniques will provide the patient the information and skills needed to perform self-administration. Safe dosage preparations require a working knowledge of basic math and meticulous care with all calculations. The average patient who is taking home a medication, we cannot assume that they have an understanding of more complex math. So we need to make sure that the instructions are very clear to them. 3 basic steps of calculations include checking whether all measurements are in the same system and converting when necessary by using known conversion factors or ratios and proportions. Again, that needs to all be done prior to reaching the consumer because they are not going to necessarily have that knowledge. 2, write the problem in equation form using the appropriate formula and labeling all parts and completing necessary calculations. And 3, checking the accuracy of your answer and having someone verify your calculation. Knowledge check. A blank is an equation that demonstrates two ratios are equal. A, percentage, B, proportion, C, fraction, D, decimal. And the answer is B, proportion. A proportion is an equation that demonstrates two ratios are equal. Method 1, basic calculation. I highly recommend that you pull this slide up and look at it. It's slide 13 so that you can follow along with the math. Example 1, the physician orders 162 milligrams of aspirin Q4 hours PRN for fever over 101. So right here I want to stop. Let's talk about what this order means. The physician wants you to give 162 milligrams every 4 hours. PRN means as needed for fever over 101. So you can give this dose up to once every 4 hours if they meet the criteria, meaning if they have a fever over 101, you can give that medication. On hand, meaning what you have, are aspirin 81 milligram tablets. How many tablets do you give your patient per dose? So step 1, you need to check and see if all measures are in the same system. So in this case, the physician's orders in milligrams. You have on hand milligram tablets, so both measures are in milligrams. No conversion is necessary in this case. Step 2, you're going to use this formula where D equals dose, OH equals on hand, remember that means what you have, and Q equals quantity. So the equation is D as the numerator over OH as the denominator times Q for the quantity. 162 milligrams is the dose ordered over 81 milligrams on hand, 81 milligrams per one tablet. So one tablet is the Q. Equals 162 divided by 81, so the answer is 2 tablets. Note that the unit labels of the desired and on-hand doses must be the same, and the unit label of the answer must be the same as the quantity. So you want to make sure that you know that there's 81 milligrams in one tablet, tablet being the quantity. Your final unit of measurement is tablets. Step 3, check for reasonableness. A drug reference source should be checked to see if this is a reasonable dosage. So for example, if you ended up getting the answer was 10 tablets. Usually when we're giving someone a dose of medication, we're not expecting them to take 10 pills of the same medication. So stop and ask yourself, does this make sense? If the calculations resulted in an answer such as 1/4 of a tablet or 5 tablets, or like I said, 10 tablets, the answer may not be reasonable and the calculation should be rechecked. If the calculations are correct after the recheck, anything that feels unusual should be checked with the person in charge, whether that be the pharmacist or the physician. When in doubt, always question. Not to share horror stories with you, but I have had medications ordered that I knew didn't make sense, and I stopped the line, meaning I refused to give it until it was clarified and got the order fixed. But that means that the physician ordered it, the pharmacist approved it, and not until it got to me did I realize this isn't reasonable, this doesn't make sense. So you always want to, if that little voice in your head is saying, this doesn't make sense, something feels wrong about this, you always want to stop and check and make sure that you are doing what you need to be doing and making sure that the medication order is accurate. Cautions for basic calculations. So you need to make sure throughout the entire equation that you are labeling all parts of the formula using the same unit label for your desired and on-hand doses. You also need to use the same unit label for the quantity and the answer. Reduce fractions to their lowest terms before dividing. So if you had, let's say, 4/20ths, that is the same as 1/5. You want to use the lowest possible term before you divide. Multiply by the quantity after dividing, so you do the division first and then multiplying. Use extra care with decimals. Convert fractions to decimals for your final answer. Round off decimals to 1 decimal place after the computation is complete. So you only want to have 0.1, 0.2. You don't want 0.1, 2, 3, 4, 5, 6. So you make sure it's only 1 decimal place. Verify the accuracy of your calculations and question the answer if it's not within normal limits. And again, your reference guide will help you with that. Knowledge check. The physician orders Valium 3 milligrams IM intramuscular pre-operatively. The vial is labeled 5 milligrams per milliliter. Which is the proper amount to be administered? A, 0.3 milligrams, B, 0.6 milliliters, C, 0.3 milliliters, D, 0.6 milligrams. We want to stop and think about this. We want our final answer to be in milliliters because that's what we can see. That's what we can visualize in the syringe. So you're going to divide 3 milligrams by 5 milligrams, so the dose by what you have on hand times quantity, mLs, and then your final answer will be B, 0.6 mLs. Method 2. So method 1 was the basic calculation method. Method 2, ratio and proportion. The 3 steps to using ratio and proportions include step 1, set up a proportion of the dose on hand and the desired dose. Step 2, make sure all units are equal. Step 3, cross-multiply to solve the equation. There is a picture on here that will be helpful for visual learners to kind of see how to set this ratio and proportion equation, how to set it up and what it should look like. So with the ratio and proportion method, I want to say it may feel kind of overwhelming to you if you haven't taken calculus or chemistry, where you'll use this kind of ratio and proportion method a lot. But I want you to pull up these slides and just really familiarize yourself with what that looks like. It's not actually as overwhelming as it seems when you can have kind of a visual of what's going on. Example 1 for this method, the preoperative order reads Demerol 60 milligrams IM on call. IM is intramuscular, and if you see an order that says on call, it typically means that the physician wants that medication ready to give. So if it needs to be in a syringe, for example, it's already preloaded into that syringe in case they need it for any reason. They may or may not use it, but it's kind of there ready in case of an emergency or in case the patient condition requires the medication. The narcotics drawer contains vials labeled meperidine, which is the Demerol. Demerol is a trade name. 100 milligrams over 2 mLs. How many mLs would you give? Step 1, same as in our other method, we need to verify that all measures are in the same system. In this case, milligrams is what we have ordered and milligrams is what we have on hand, so no conversion is necessary. Step 2, we need to set up the problem as a ratio and label all terms. The dose on hand is 100 milligrams over 2 mLs, and the desired dose is 60 milligrams over X mLs because X is what we're trying to solve for. Step 3, we're going to cross multiply, and what we end up getting from that is 100X equals 120 because we multiplied the 2 mLs by the 60 milligrams. Then we divide both sides by 100 to isolate the unknown variable. 100x equals 120, so you need to divide 100x by 100 and 120 by 100, and our answer is x equals 1.2. Step 4, check for reasonableness. A dose of 1.2 ml is within the normal dosage range. You could get that using a reference guide, but it is also something that you'll kind of start to know in terms of liquid, that we do not give more than a certain amount of liquid within a muscle. Typically, we try not to give more than 2 mLs. That there's a little bit of wiggle room in that, but 2 mLs is a pretty good one to remember. So let's say your dose was 5 mLs intramuscularly. That would give you pause for concern. Like, hey, that's not a normal amount of liquid that would go into a muscle. Cautions for this method. Be sure you label all parts of the formula. The ratio on the left is going to contain the known quantity, and the ratio on the right contains the desired and the unknown quantities. The terms of the second ratio must be in the same sequence as those in the first ratio, and then you need to cross-multiply to solve for unknown variables. Use extra care with decimals to ensure accuracy. Convert fractions to decimals at the end and then round off the decimals to 1 decimal place. Be sure to label your answer and use the unit of measurement in your final answer. Verify the accuracy of your calculation and question the answer if it does not appear to be within normal limits. Knowledge check. The physician orders liquid ibuprofen 25 milligrams q12 hours. The bottle is labeled 12.5 milligrams per 1 teaspoon. Which is the proper ml dose to be administered? A. 12.5 mLs, B. 25 mLs, C. 10 mLs, D. 12 mLs. So this is hard to do, again, via audio because I can't write it out for you. But if you are supposed to give 25 milligrams for the dose, and there's 12.5 milligrams in 1 teaspoon, you're going to do that calculation and you're going to end up finding out you need 2 teaspoons, okay? Then you need to know what the teaspoon and ml conversion is, and it is that I know off the top of my head, but you may need to look up at this point. 1 teaspoon is 5 mLs. So if I'm giving 2 teaspoons, my final answer is C, 10 mLs. Pediatric dosage. Children are not small adults, therefore you cannot take a portion of an adult dose and give it to a child. What this really means is if you are giving a medication to a pediatric patient, the way that they metabolize is different, the body fat percentage to muscle percentage is different. There's just a lot of factors that means that you can't just take this adult dose and modify it. You need to actually use a pediatric dosage calculation. There are various formulas for computing an approximate child's dose based on body surface area, weight, and age. Other factors that must be taken into consideration are metabolic, pathological, or psychological conditions. When preparing drug dosages for children, it's important to reference recommended doses found in the drug insert, physician desk reference, or American Hospital Formulary Service. 2 commonly used rules to calculate dosing for children include 1. Young's rule, which is based on the child's age in years, and is useful for medications that have variations in dosing based on age. So Young's rule says age in years over child's age in years plus 12 times adult dose equals child's approximate dose. The second one is Clark's rule, which relies on the weight of the child, which is going to be much more accurate for medications that are affected by body size. Clark's rule says child's weight in pounds over 150 pounds times the adult dose equals the child's approximate dose. I will say in general, I have not really used these rules so much as I have used like a body surface area calculation, I have used a general pediatrics dosing table, or in the emergency department, if a child comes in critically ill, we have what's called a Broslow tape. And for all of the emergency medications, you lay the tape alongside the child, and based on their height, it gives you what their approximate weight and age is, and then it gives you a whole list of the dosages for emergency medications. So there's many different things you'll see that are different for pediatrics. These 2 rules do sometimes still come into play, but I don't see them as commonly in the hospital setting. If you were to see one of these, it's more likely that you'll be using Clark's rule, which was the second one we talked about. So there is a knowledge check here, and it is a very long and very complicated equation. I actually wouldn't expect you to be doing these at this point in this basic pharmacology course. And there's also a typo, which makes it a little confusing. So what I want you to do, I want you to go ahead and skip this, but I will put this equation separately. I will write it out and I will link it into the module so that you can see how we would do this conversion and how we would do the check. Geriatric dosage. So geriatric dosage preparation and administration for older adults uses similar special considerations as children. Older adults taking multiple drugs are at risk for potential lethal interactions. Since there is not a formula to guide safe geriatric dosing, it's recommended to start low and go slow. That's a phrase that you will hear a lot in pharmacology. Start low, go slow. Performing assessments on an individual basis, consistent monitoring, and reduction of dosage whenever possible sets the standard for rules to follow in geriatric dose preparation. So what are some factors that could lead to possible dangerous cumulative effects that can lower metabolism? These include poor circulation, impairment of liver, kidneys, lungs, or central nervous system that are involved in processing the medication, chronic disease, dehydration or electrolyte imbalance, and debility, meaning that there is some kind of debilitating disease process that is affecting the way that the medication's working, affecting the able-bodiedness of the person, the muscle tone, etc. Knowledge check. Which is a considered variable to be assessed to assure safe drug preparation for a geriatric patient? I don't love the way that this question is written, but it's essentially asking which of these could impact patient safety if this factor was present. A, fully functioning lungs, B, controlled blood sugar, C, sufficient electrolytes, or D, debility. So if you look through those, 3 of those are good things. Those are for a able-bodied, typically functioning adult, and one of those is something that could affect medication safety. So the answer is D, debility. Prevention of medication errors. Medication errors can occur for reasons such as improper documentation, administering the wrong drug in the wrong amount at the wrong time, by the right route, or to the wrong patient. So to avoid misinterpretation of an order, you should always place a 0 before a decimal point. For example, 0.2, 0.5, to reduce the risk of overdose. Never place a decimal point and a 0 after a whole number. For example, if you wrote 5.0 milligrams, that could easily be misinterpreted as 50 milligrams. The correct way is to write 5 milligrams. Avoid using decimals whenever whole numbers can be used as alternatives. So a great example of that, using your units of measurement, is if you needed to give 0.5 grams, go ahead and use milligrams instead, because you can use a whole number, which would be 500 milligrams. Have a second qualified person double check any calculations for accuracy. Again, someone who's qualified needs to have this skill in their scope of practice. So if you're a nurse, it should be another nurse or a physician, etc. And lastly, always question the order if you have difficulty interpreting the spelling of a drug name or the number used for the dosage, or if the dosage seems inappropriate. So again, for a medication to be given correctly, we need to give the right drug, the right amount, the right time, the right route, the right patient. Okay? And then we also need to make sure our documentation matches. Knowledge check. Which is not one of the 5 steps to reduce medication errors? A, never place a 0 before the decimal point. B, never place a decimal point and 0 after a whole number. C, always question the order if dosage does not seem right. D, always have someone verify your calculations. And the answer is A, never place a 0 before the decimal point, because we know we actually want to always place a 0 before the decimal point. Self-assessment. 1. What are the 3 steps to using proportions and ratios? 2. Which variables are considered for safe dosage in geriatric patients? 3. What are the 5 steps to reduce medication errors? This has been Chapter 6 of Essentials of Pharmacology for Health Professions, 9th edition. Thanks for listening.